Hi, I'm pharmacist Kevin Hope, and welcome to 5 Minutes with a Pharmacist. Today, I'm here with Dave Shifrin. Now, Dave, you have an interesting job. We were talking a little bit before the interview started, and Dave works in an emergency department at a level 2 trauma center, 500-bed hospital, part of the Cleveland Clinic system there, Fairview Hospital. Now, Dave, you were talking about kind of how your world has changed since we all started talking about COVID back in March. And I'm sure our listeners would love to hear kind of your perspective on the COVID-19 pandemic and kind of how that has affected your world.
Yeah, absolutely. So from my perspective, what we've been dealing with, obviously here in the state of Ohio, we've started to see quite a significant surge, more so than we saw earlier in the spring and over the summer, where, we did a very good job of keeping the numbers down. We're starting to see a fairly significant surge. Um, and part of our responsibility within the emergency department is obviously providing that evidence-based medicine and that pharmaceutical care for both our patients, providers, and obviously the nurses as well. And I have a terrific team that's around me. I have two other emergency medicine pharmacists that work with me. We have a PGY2 emergency medicine pharmacy resident that we also rely on. We're there 20 hours a day, so we work 10-hour shifts, two of us. And a lot of what we do is obviously working side by side with our nurses, our physicians, our physician assistants. We are at the bedside for all medical emergencies, so traumas, cardiac arrests, intubations, so on and so forth. And we are obviously the medication therapy expert that is in the room, so providing those drug therapy recommendations to our providers, as well as being a conduit for the nurses to the providers when they have questions about titrating drips or certain medications, how they should initiate them. We're obviously there to provide that education. And we also provide obviously patient education within the department. One of the challenges that we now face, obviously, with COVID is every person that comes in, we just assume is COVID positive. So we need to, we've all really started to lean on one another, make sure that we take care of one another, don't put each other at risk. So we make sure that we're all wearing appropriate PPE within the emergency department, which Cleveland Clinic has done a great job ensuring we have enough of. So, that's having appropriate eye protection as well as a mask. If we're dealing with a more invasive procedure, such as an intubation, that then will require N95, face shield, hairnet, gown, going a little bit above and beyond. But really all of us relying on one another, trying to, like I said, keep each other safe, as well as just being there more so than just a colleague, but almost as like we've become family. We're all going through a lot right now, seeing the surge. We're all putting in long hours. We're having to deal with increasingly sicker and sicker patients. Our volumes have gone up. Our hospital is starting to fill up. So we're starting to have what we call hold patients in the emergency department. So we don't have enough beds. So now they're in the emergency department, which obviously further increases our need, especially if they're, an intensive care unit patient that might be on multiple drips, working with the nurses to make sure that those are being titrated appropriately. But really, it's all about just keeping each other safe. And I have a great team around me, and I'm very fortunate to be working within this emergency department, having all the help and support that we do have.
Perfect. Now, you had mentioned, of course, the need and the working across many, many different professions. And you unfortunately have seen some colleagues who have who have tested positive. And you mentioned that you consider every patient as being COVID positive when they come in. So kind of, what does that look like from the pharmacy perspective?
Well, from a pharmacy perspective, it actually makes it much easier. Where I think obviously some of the caregivers that work in the department with us that test positive, based on what we've been learning, is a lot of it's actually happening outside of the emergency department within the community. So it makes our jobs much easier because since we're just assuming everybody's positive, we're not trying to change, we don't have to change how we approach each patient. So each patient, we're going in with the appropriate personal protective equipment. Like I said, assuming that they're positive. So we don't have to continue to change or alter our behavior, even if somebody comes in with, they fell and potentially dislocated or broke their ankle, and we're having to go in the room to do a procedural sedation reduction. We're still going in that room as if they're COVID positive. And until their COVID does come back, that's how we're assuming every patient that comes in is. And like I said, it just makes our lives easier because we're just approach every patient the same way. We gown up the same way and nothing changes.
Right. Well, thank you so much for being with us today. We really appreciate your efforts there on the front line in Cleveland. And we appreciate everyone tuning in for today's episode of 5 Minutes with a Pharmacist.